Now we'll discuss the pulp protection topic. So, one of the basic goals of conservative dentistry is to preserve the health of the dental pulp. But the pulp is always subjected to various insults or irritants that includes the disease process itself, that is the caries, trauma, attrition, abrasion or erosion, or the mechanical irritation during cavity preparation by the excessive heat, or by the certain chemical components such as the phosphoric acid of the zinc phosphate cement, or the thermal irritation by the temperature change to the pulp, and the micro leakage which allows the bacteria and noxious products to gain access to the pulp. Therefore, the pulp protection is needed against all these mechanical, thermal, and electrical irritants to protect the pulp from the various irritants. Now we'll see the importance of the remaining dentin thickness. It is the depth of the cavity preparation of the pulp is the single most important factor in deciding the best method of pulp protection. It is the amount of the remaining dentin or the sound tooth structure which is left after the cavity preparation. In this picture, you can observe the amount of the remaining dentin which is present. It is less in the first picture and more in case of the second picture. If we observe the pulp protection according with the depth of the tooth preparation, in case of the silver amalgam cavity preparation, that is for shallow cavity preparations with more than 2 mm of the remaining dentin thickness, 2 coats of the varnish or sealing with the dentin bonding agent prior to the restoration is recommended. Whereas for moderately deep cavity preparations with 0.5 to 2 mm of RDT, a cavity base is applied on the pulpal or axial wall followed by the restoration. Whereas for the deep cavity preparation with less than 0.5 mm of the RDT, a calcium hydroxide liner is placed to a thickness of 0.5 to 1 mm at the deepest portion. In case of the GIC, only the deep cavity preparations close to the pulp are used, and they require the pulp protection in the form of a calcium hydroxide liners. Now we'll see for the composite restorations. The dentin bonding agents are preferred agents to bond composite restorations to the tooth structure in case of shallow and the moderate cavity preparations. Whereas in case of the deep cavities with less than 0.5 mm of RDT, a calcium hydroxide liner, preferably visible light cured calcium hydroxide, is applied over deepest portion. Whereas in case of the cast restorations, for shallow preparations more than 2 mm of RDT, only the luting cement is used to seal the interface. Whereas for the moderate deep restorations, a suitable base is applied at the deeper portion. For deep preparations close to the pulp, a calcium hydroxide liner covered with a suitable base is recommended. Now we'll see the classification of the pulp protective agents. One is the cavity sealers, which can be divided as cavity varnishes and the resin bonding agents. Next is the cavity liners and the cavity bases. If you observe the what is a cavity varnish is. The cavity varnish is a natural gum which contains the copal or the resin or a synthetic resin which is dissolved in the organic solvent like acetone, chloroform, or ether. But on application on the tooth surface, the organic solvent evaporates, leaving a protective film. So, the varnish is commonly used beneath the amalgam restorations to seal the amalgam tooth interface until the corrosion products form to reduce the marginal gap. The thickness of the varnish is usually 2 to 5 micrometers, and the 2 coats of the varnish produce an effective sealing. And the varnishes are contraindicated under the GIC as they interfere with addition of the cements, and also under the composite restorations as they interfere with polymerization process. Now we'll observe what our cavity liners are. These cements are cement coatings with a minimal thickness which serves as a physical barrier to the bacteria. They also provide some therapeutic effects like fluoride release and antibacterial effect. And if you observe, one of the cavity liner is a calcium hydroxide, and it is employed in the deeper cavity preparations due to its biocompatibility property, reparative dentin ability, and also its antibacterial activity. And now we can discuss about the GIC liner. These materials is used as a liner as well as base primarily because of its high desirable properties like fluoride release and chemical adhesion to the tooth structure. It can be placed in moderate to the deep cavities. Now we'll observe the resin bonding agents. Dentin bonding agents are currently the accepted method of bonding composite resin to the tooth structure. Apart from adhesion, they are also recommended for cavity sealing. Now we'll see what is cavity bases. These materials that are used to replace the missing dentin or to block out the undercuts in the preparations for indirect restorations. This thickness can increase up to 2 mm as the depth of the cavity increases. They are usually placed in the thickness of 0.5 mm. They can be applied on the pulpal as well as the axial walls of the cavity preparation. One of the cavity bases is a zinc phosphate cement. Traditionally, this has been the material of choice as a base under the metallic restorations because of its physical properties and also the excellent thermal insulation property. Next, we'll see the zinc polycarboxylate cement. This is also the popular base material because of its advantages over the zinc phosphate cement are its biocompatibility and adhesion to the tooth structure. We can also see the GIC, which acts like a base and also helps in coverage of the tooth material. It can be used under the amalgam, composite, cast gold, and the ceramic restorations. Now we'll see what is indirect pulp capping is. In case of deep caries lesions, a caries in the dentin may be close to the pulp. Normally, what happens is all the caries dentin should be removed during or before placement of the restorations. But in some situations, what happens is when the complete removal of all the softened caries dentin may result in the pulpal exposure. So, some of the caries dentin is just left behind, which can be protected with an indirect pulp capping agent such as calcium hydroxide. What is the rationale behind this procedure? If you see, the calcium hydroxide is being alkaline in nature can eliminate all the remaining bacteria and render the residual caries dentin sterile. So the placement of the well-sealed interim restoration such as the GIC over the calcium hydroxide liner will deny the remaining bacterial nutrients for further acid production and arrest the caries process. Now we'll discuss the direct pulp capping procedure. Sometimes what happens is the pulp may get exposed either due to the caries trauma or as a result of arterial errors during operative procedures. So the direct pulp capping is a technique for treating an exposed pulp with a material that seals the exposure site and promotes the reparative dentin formation. Here, one of the criteria is that the size of the exposure must be as small as possible, that is 0.5 mm in the diameter. And the hemorrhage also from the exposed pulp must be easy to control. And the tooth should be also asymptomatic. And however, the calcium hydroxide has been the material of choice for various direct pulp capping materials, and but nowadays the recent materials such as the mineral trioxide aggregates such as the MTA, which was developed by Torabinazid, may be the widespread acceptance as a direct pulp capping agent.